For a number of years, government hospitals have been the big brother in the health sector. However, the trend has since shifted to private health service providers. According to recent surveys, it's turning out to be one of the sectors that has been infiltrated with non-professionals. Dr. Margaret Mungerera, the president of Uganda Medical Association, says this infiltration has mainly hit the private sector service providers.
But 75% of the clinics were run by quacks. So even the people they are calling doctors in the private clinics are not doctors, they are quacks.
One of the arguments attributed to the poor performance of the private health service providers is the non-active participation of government and poor supervision.
To those who have come in to help government to supplement the services by providing private health care.
There seem to be poor supervision, especially on the service providers in the private sector. Unlike in government, the public health facilities,
there are several other factors that private practitioners are facing. For instance, there is a challenge of equipment, and some people are not actually well facilitated.
Even with the challenges, some medical experts credit private-run facilities over the gap they have filled in providing health services to the public.
In the private sector, we are held accountable by the clients that we serve. It is a different picture from what you see in the government hospitals, where sometimes it is very difficult for a person in a rural area to hold a health worker accountable for their actions.
You look at the private practitioners, they almost get no support at all. So all these hospitals that you see that are being set up, we want those hospitals there because they do provide, more sophisticated care.
However, Dr. Mungera argues that there are a number of problems that need to be addressed.
Instead of complaining that you are doing this and that, government should support them because they're here to stay and government needs them.
Now, what some medical practitioners believe can improve the services in the private sector is for government to come on board and introduce the public-private partnership.
It is on paper. It has not fully been implemented. You get what I'm saying? And I think we need to get it off the paper and implement it. And one way is to have a strong collaboration between the private practitioners.
And to the Medical Association of Uganda, regulations have to be followed and empowering of regulatory authority is key.
I, as Uganda Medical Association President, am a member of that council. And I actually chair the Ethics and Discipline Committee. If we find the doctor or the hospital is at fault, then definitely the doctor will definitely suffer some consequences. It can range from a caution right up to suspension from the register. Yeah, and even erasure from the register.
However, other medical experts blame patients for poor services since such malpractices are never reported.
Hospitals are doing very well, although I think some of the complaints that people make may also be unrealistic. Some of them are realistic because, to me, being a patient, sometimes a patient has to be patient. But unfortunately, some patients are not patient. But on the other hand, it is also true that there are some other hospitals that look at, like complaints of overweighting, say in the line.
All this follows the death of Remi Wamala Nanono, the coordinator of Uganda Parliamentary Forum for Children, who died while giving birth. Also, last year there was one Moses Agaba whose son died at one of the private hospitals after the parents failed to secure blood. Maurice Ochol, NTV Weekend Edition.